till adults with congenital heart disease is a new group of patients that exists recently in medicine. This group of patients, they didn't exist about 50 to 60 years ago, simply because cardiac surgery, cardiac anesthesia, and nurses and everybody and cardiologists, they didn't have the experience at that time to take this patient through the journey. These patients, they come with congenital heart disease. They are born with congenital heart disease. And thanks to advancements in medicine, that these patients, they have pediatric cardiologists, cardiac surgeons, cardiac anesthetists, nurses. They take them through life from the day they are born till the age of 80, even 90. So it's to have a congenital heart disease, it's not a matter of being a child with congenital heart disease. Nowadays in the UK, there are centers that are dealing with congenital heart disease, dealing with pediatric cardiac surgery and pediatric cardiologists. They are moving to having programs to deal with adults with congenital heart disease. So it's relatively new in medicine to have these programs, and relatively new for some hospitals to have these programs or have these centers. The slides doesn't move. Yeah. Do you hear me?
Yes, we hear you, Dr. Afshan.
Okay.
Clearly.
A child born with congenital heart disease 50 years ago had no chance of surviving to the age of 18. There are now more adults with congenital heart disease than children. Because thanks to centers like you, they deal with pediatric congenital heart disease, they operate, they look after them, so they live longer. And living longer, it's good for the society because according to the extensive research, individuals between the age of 60 and 70 are at the peak of their productivity. So old age doesn't mean that you are not productive. You are productive, and according to the research, the productivity increased between the age of 60 and 70. And surprisingly, at least to me, that the lower productivity happens between the age of 50 and 60. In the UK, in a year, about 26 million working days were lost due to congenital heart disease, at a loss of 2.6 billion pounds. So it's a very expensive thing, and to have these patients in a good shape and working, it's good for the society. So it's not a matter of, not a money wasted. So if you have a center like yours, depending on donation from different bodies, you are actually saving a lot of money for the society. In the future, we are likely to see the service moving from one that is focused on the children to another one that's treating growing number of young people and others who will continue to have complex health needs. Just to give you an idea how we are moving over the last 200 years, in 1800s, late 1800s, congenital heart disease was considered as a disease that is incompatible with life. It was, if you have a child with congenital heart disease at this time, the doctor would say, no, I mean, this disease is incompatible with life. But having said that, the parents, they love their children unconditionally and forever. And they want you as a physician to do the utmost to save these children. To assess the progress we've been through in the last 100 and 150 years, I just recalling what Winston Churchill, who was the Prime Minister of the UK in 1944, i.e., during the Second World War, and he was saying that progress can only be seen by comparing present with past. The longer you look back, the further you can look forward. And the future is an extension of the present. He was saying this at the meeting with the Royal College of Physicians in the UK during the Second World War. Cardiac anesthesia intertwined with cardiac surgery. Both the cardiac anesthetist and cardiac surgery, they cannot work by themselves. They need each other. And I have to say that they need surgeons, they need nurses, they need cardiologists, they need everybody. It's a teamwork. But I am concentrating this too because this is what what I've been doing. So the cardiac anesthesia intertwined with cardiac surgery. Cardiac surgery developed rapidly over the last 100 years, and the cardiac anesthesia comparatively younger than cardiac surgery. But it has evolved in the last half century. Adult with congenital heart disease affects people age 16 and over. The cut-off point here is not clear. Some people, they say it's 18 years. When you are 18 years, you move to adult service. You become an adult. Some of them, they say, no, when you are 21. So anyhow, above 16, you are considered in some countries an adult. And this congenital heart disease, you get it when you are young. You are born with it. And you are expecting sorry, I'm having the slide has changed by itself. Are you moving the slides or am I moving it?
You can move it, Dr. Amin. So just open the video to see the audience.
Anyhow, this children that they become adult, they are considered largely they live longer than before because of the advancement in cardiac surgery, cardiac anesthesia, and nursing care. In the UK, there is increasing number of adults with congenital heart disease. In every 1,000 adults, there are 4 patients with congenital heart disease. And the number is anticipated or expected to increase. And having said that, in spite of the fact that the number is increasing, but these people or these patients, they live longer. This This slide showed you that the patients or children with congenital heart disease, they are stay static for most of the years. While what's increasing in number is adults with congenital heart disease, whether these adults are less than 60 years old or more than 60 years. Some of them, they reach to their 80s and 90s. So these people, they live longer than before. And to look back, congenital heart disease is the most common and the deadliest birth defect in the world. This is in the world. In UK, cleft lip and palate more common than congenital heart disease. And it affects 10 in every 1,000 babies born in the UK. It's about 1%. In Egypt, I was glad to see this number, whether it's true or not true, that the number of patients with congenital heart disease in 1,000 is less than UK. And each day, around 13 babies are born with congenital heart disease. And in the US, there are about 40,000 children born with congenital heart disease. So in the UK, 5,000 babies born with congenital heart disease. In the US, 40,000. This is because the population of the UK is about 60 to 65 million, while in the States there are more than almost close to 400 million. And in the last 25 years, deaths has fallen dramatically. 83% of the children with congenital heart disease, they are expected to survive longer, to live longer. Sorry, I have problems with moving slides, but
Can you try now, Amin?
I'm trying. I will do whatever I can do to. So as I said before, this group of patients, they didn't exist before. So it's something new in medicine. It happened in the last 50 years. And because it's something new, some centers in the UK that they are dealing with congenital heart disease in babies, they start of having or forming a program or centers to look after these children. They take these children from the day they are born till they practically till they die. It's a long journey, and you have to have specialized people looking after these children and to move with them during their lifetime from the day they are born till the day they go to the grave. And this service or program or team will not be doing their job without being cooperative together. And the service objective, you have to have the service or the program or the need for it. And the service objectives for this case is providing high quality and timely and accurate diagnosis. Not all not all patients with congenital heart disease, they need care, continuous care. Because congenital heart disease, in spite of the fact that you are born with it, some of them, they live till adult age and even longer, 70 to 80, without knowing that they have a hole in the heart. I've seen patients up to 60, 70 years with ASD or small VSD without them knowing that they have this defect because they didn't need treatment. So the span or the spectrum of congenital heart disease varies a lot from a very simple ASD, VSD to complex lesions like TOF and TGA to a very complex lesions like single ventricle. So the spectrum is very wide. And some patients, they are not aware of having congenital heart disease till they go into routine examination for a job or military or whatever they go through, and they are discovered accidentally that they have a hole in the heart. So anyhow, as I said, we have to have a service or a program or a center to deal with these patients. And the objectives are many. And the most important thing is to provide high quality and accurate diagnosis, agreeing treatment plans with parents and their families, undertaking safe and effective congenital heart surgery and catheter intervention. Not all these patients, they are not ill all the time, but they may need surgery and resurgery, and the same for catheter interventions. They have catheter intervention when they were babies, and they may need the same when they are teenager or in adolescence. The objective of this service is to provide also psychological support to these patients and their families. It is very, very important to support these patients psychologically. And at the same time, ensuring a smooth transition from pediatric to adults. Transition is a very important period for these patients. When the patients are young, the care is family centered. The parents will take the child to the doctors, they will arrange the appointments. Moving to an adult, the adult will do this in him or herself. They can arrange, so they are moving from a family centered care to an adult care. He or she will take after himself. To the extent that some centers they have a transition day. They bring the patients, families, doctors, everybody involved with this adult with congenital heart disease to a transition day, so they can talk about their experience in life. So transition from pediatric to adult is very, very important, and it's a process. It's not just a matter of writing a letter from pediatric cardiologist to another cardiologist, please take care of this patient. No, it has to be slowly and over the years. And the patient themselves have to be prepared by talking about it when they are 17, 18. So it's process. It's not just a jump from from pediatric to adult. And the whole idea is to support these patients to be independent, not hindered by the disease they have. And this will be achieved by effective communication between patients, families, and the service providers. And to provide a treatment and individualized care for these patients. The one that's most important is to have the feedback from the patient themselves and the family, and whether they are happy with the service or not. Because having the feedback, you can see what you are doing and whether you are happy with this or not, and whether you are satisfied with it or not. It's not just to say that you are good or bad. I mean, it is important to have the feedback and build on it for the better service. Sorry, I'm having problems with the slides, but yeah. The aim of the service is to prevent patients from dying prematurely and enhancing their quality of life to live longer without any hindrance, and helping people to recover from the episodes of ill health. Ill health in this group of patients, because they become adults. So they can have any other disease like anybody else, from gallbladder inflammation to kidney, liver, lung, any other disease, not necessarily cardiac disease. They are adult, hopefully living normally, and they can have diseases like anybody else. And hopefully they will have a positive experience of this care. To provide a team or a program or a service for these patients, and I'm talking about UK here, but it could be applied in your place because you depend on donation, and the fund comes from non-governmental bodies. And the centers or the service or the program for adult congenital heart disease should provide accommodation for families to stay, and hopefully without charging them, access to refreshment, facilities suitable for storage and the preparation of simple meals, and a place for the family and to talk to the patient and the family separately. So it is a specialized service for certain people and special people that didn't exist before. And this team is multidisciplinary team. It involves everybody from pediatric cardiologist to cardiac surgeon, anesthetist, nurses, kidney, liver physicians, all the specialties involved in this care, in the care of adults with congenital heart disease. This is saying the same, but in a different presentation. So the specialist centers and the multidisciplinary team comprising of the following: cardiologist, specialist in adult congenital heart disease. The cardiologist that specialist in adult congenital heart disease could be a pediatric cardiologist that has interest in adult congenital heart disease, or the other way around, adult cardiologists that interested in the congenital heart disease. So you can wear any hat, and you can be pediatric cardiologist and not just specialize in pediatric cardiology, but you can extend your experience and interest in adult with congenital heart disease. And the center should have a cardiothoracic center, a cardiothoracic surgeon, an anesthetist, which should be very much aware of the current disease and whether there are any changes that's happening over the years with these patients. And also there should be a radiologist, perfusionist, dental surgeon, obstetrician, clinical psychologist, physiotherapist, dietitian, social workers, and even administrative staff. It's very important. You cannot be a doctor and sending letters to the patient or arranging a meeting or visits of the patient. You have to have somebody to help you. The same for nurses. It's a very, the nurses, we cannot work without nurses. Nurses are the extension of our arms. And they have to be specialized and know and aware of congenital heart disease in adults. Adult congenital heart disease is fascinating, really, and it offers a professional lifetime of endless variation. Not all the patients are the same. They vary quite a lot. As I said, some of them with simple cardiac lesion or complex or even super complex. And the cardiac anesthetist must sometimes be generalist. Or being generalist, it doesn't mean that there is no subspecialty or super specialty with adult congenital heart disease. And as I said, you are partners with your colleagues. You are a team. You cannot function without them, and they cannot function without you. So you are cooperating with each other. In the UK, there are about 40 cardiac centers, 40 or more, 40, maybe 45 centers that they perform cardiac surgery. And few of them, they have the facilities for pediatric cardiac surgery. And these centers that they have facilities for pediatric cardiac surgery, they start having programs for adult congenital heart disease. But saying that, not all grown-ups with congenital heart disease require the same level of expertise. 20 to 25% are complex and they require lifelong expert supervision and intervention. 35 to 40% require access to expert consultation, and 40% they have simple or cure disease and need little or no specialist expertise. So if out of this 100%, 40% they don't need us, they don't need continuous treatment. But at the same time, they have these patients with congenital heart disease, as I said before, it's a long journey from childhood to adulthood. and they have to carry on with their lives because changing from pediatric to adults, these adult patients, they are adults by the whole meaning of the word adults. To conclude, there is a need for increased awareness and understanding of the term adult with congenital heart disease, both on individual basis and on the population. And with improvement of transition period, I cannot stress more about the transition. It's very, very important. And if you want to provide a cutting edge care and top notch, and to be on the top notch of your field, you have to carry on with the research and innovation. Cardiac surgery has changed the life of this patient, but at the same time, it hasn't been complete cure. And tertiary expert care is needed for this patient. Unfortunately, with every people or patient with congenital heart disease, they live longer, but there is a price for this. And this price is that this patient in their lifetime, they suffer from heart failure and pulmonary hypertension. And this heart failure or pulmonary hypertension could be mild, moderate, or severe. And the anesthesiologist or anesthetist plays a major role in this care. And they should know the native cardiac lesion and prior surgery or repair, the current cardiopulmonary reserve, and to assess the risk and develop an aesthetic plan appropriate for the lesion. And having said that, this is in theater, anesthesiologist plays a major role in the intensive care. You can be a pediatric cardiac anesthetist. You can stand on your own on a solid base. And the same if you are an adult cardiac anesthetist, you can stand on your own in a solid base. But if you combine both, you can have broader base with a stronger structure.
شكرا دكتور امين، محاضره جميله وموضوع فعلا مهم وهو فعلا بيزيد اهميته واحتياجنا ليه يوم بعد يوم. يعني هو فعلا موضوع احنا يعني من الحاجات اللي هي على التوب برايورتي حتى عندنا هنا في المستشفى. الحالات دي فعلا بتزيد ويوم ورا يوم بتزيد اكتر واحتياجنا فعلا ليها بيزيد. يعني بنشكر حضرتك على المحاضره الجميله وفعلا يعني هي زي ما حضرتك قلت هي بروسيس وبروجرام كامل في نقط كتير لازم نبقى واخدين بالنا منها. شكرا دكتور امين واحنا يعني
if I may say something that because these patients are new to the medical field,
بالظبط
I want to just to draw your attention to this. And then hopefully some of you will dig further deep into this matter and maybe start the program or the service in your hospital.
احنا فعلا بدانا البروجرام سبيشالايزد بروجرام للادلت كونجنتال وفعلا اسايند سيرتن يعني ما بين البيدياتريك كارديولوجي والادلت كارديولوجي طبعا والسيرجن والانستيزيا. البروجرام يعني ككل بدا يعني يبدا خطوه بخطوه كده، وان شاء الله هوب يعني ان احنا يعني نقدر نساعد البيشنت يجي بشكل افضل والاوتر يبقى احسن شغل.
It's good that you are starting, but at the same time, the patients themselves, they should know that they have to stick to their doctors and not to keep changing them. The doctors that is specialized in adult with congenital heart disease should know about that child when he was a child, about the patient when he was a child, and that this child is growing up, because being an adult is completely different than being a child. Being an adult, it means that you are looking for work, you are looking for a job, you want to have family. I mean, even women with congenital heart disease, some of them they like to have family, they like to have children, they like to be pregnant. So we have to care and take care of this patient closely. And the patients themselves, they should feel happy and they should feel secure to come to the physicians whenever they want. They should feel that the team, the adult congenital heart disease team, is there for them and they can approach them whenever they like. And this will not be achieved if you are paying for it. In a place like you, funded by organization, social organization, you can do such a thing. If you are paying for it, it will be very expensive for the patient and not everybody can afford it.
شكرا لحضرتك دكتور امين، ويعني كلام طبعا حضرتك يعني كلام فاليبل جدا، واحنا يعني ان شاء الله يعني نستفاد من محاضره حضرتك دي، ونقدر ان احنا نبقى على التراك ان شاء الله. انا يعني بس استاذن حاجه، انا يعني عشان نبدا هو المحاضره اللي بعديها هنبداها، بس عشان اللينك هيخلص، فانا هقفل اللينك مع حضرتك دلوقتي وارجع اخش تاني، وحابب بس اخش من نفس اللينك اللي موجود مع حضرتك.
طيب ماشي، اتمنى ان الامور تبقى كويس. ماشي طيب، حاضر.
كويس ان شاء الله.